Well, to summarize dental school, it's very much about long school hours. We have school hours from 8 a.m. to 5 p.m. And we're a very close-knitted class because we only have about 60 people per batch. Yeah, of our seniors, they actually have less people per class. So it's a really small batch, and I receive a lot of encouragements from my classmates through stressful times, and I really appreciate how small it is actually. I really like it. Yeah. And another thing is that there's a very steep learning curve. You kind of go into dental school not knowing what dentistry exactly is about, and every day you kind of learn new things and a lot of deadlines. You got to juggle with them, juggle with exams. There's a lot of exams in dental school. That's when things get really stressful, especially in year 2. There are like weeks that just have so many exams, and I was like, how am I gonna go through it? But I mean, in the end it works out. So it's stressful, but it works out. Yeah, we have a lot of subjects that we have to learn in year 1 and 2, which are very similar to what medical students learn. That's not even considering the fact that we have dental school subjects, and it's very content heavy. But it's important to know it, because if you don't know your content, you don't know your theory, you can't treat patients well because you don't know what you're doing. So for me, I'm okay with it because I know the importance of knowing, like having to know all these. It's not like A-levels where, like, you know, you're studying just to cope with exams. So I'm actually quite okay with it being content heavy. Yeah. Well, technically I didn't. I chose to go to medical school for my first choice, but I didn't get in, and I got into my second choice, dentistry. I chose dentistry because I kind of didn't know what I was doing. I didn't know what else I wanted, and I thought I really wanted to be in healthcare, and I guess dentistry is quite close to what I initially wanted, so I went ahead with it, took a plunge, went in, and I have never regretted it ever. And if I could choose again, I would choose to put dentistry as my first choice. Yep. I think it's that you're dealing, I guess one thing is you're dealing with so much teeth. Like, I would never expect to bring teeth home, but yeah, I've brought many teeth home actually. I think that's a bit weird. My family gets a bit freaked out, but it's so part and parcel of my life now. Like, I'm okay with it. It's to tell me that it can be a very fulfilling job. It's not just about teeth. I mean, it is a lot about teeth, but well, I guess before I joined dental school, I used to just think, oh, being in dentistry is just dealing with teeth. How can I be passionate about teeth? Well, after I joined dental school, I found its own meaning in caring for patients. It is a very different course from medicine, but a common theme is that you can care for your patients. What I really like about it is that it's very technical though. Like so much have told me that it's quite fun, right? Like dental school is quite fun. You don't see people dozing off in class. I mean, for lectures, yeah, but no one would doze off in lab or like clinics, because how can it be boring to be drilling teeth? It's fun and stressful, but it's nothing near being boring. Yes, I would do dental clinic attachments. I didn't do it. I don't know how I got into dental school. If you want to do dental school, I recommend you to go for attachments, because I guess you can see what being a dentist is like. It's not for everyone. It really isn't for everyone. You need to know why you're doing dentistry. If not, it's very hard to get through dental school. I guess at the start of dental school I was a bit lost, but a lot of my classmates knew exactly what like this tool is called, or like this, like what a crown was. I didn't even know any of that. Yeah, so if I had a chance to travel back in time, I would go for dental clinic attachments. Sometimes in dental school, because it's very rushed, right, there's a lot of deadlines and you start rushing things. It's very common. Like, I will admit that there was actually occasions that I rushed through my things. I didn't really care about the quality of it sometimes. And there was one dentist who told me, in a very nice way, he's a very nice dentist, he told me, first step of being in healthcare is to do no harm. And it never struck me that in dentistry, like something as simple as making dentures, I can harm a patient. But what he said really just like made me think. If you make a bad pair of dentures, you cause a lot of discomfort to the patient. You can even make the patient lose their teeth. That really made me take my lab work and my academic revision a lot more seriously, because I want to be a good dentist who helps my patient and not to do harm with mediocre or subpar work. It can be quite difficult, especially in year 3 and 4. I've heard from my seniors that you know, you have very long school hours already, and when you start seeing patients, you have to have even longer school hours, because you kind of have to prepare and for your patients, you know. And another thing is to note is that, like, most people I know in dental school do not have CCAs, or if they have it in year 1, they kind of drop it along the way. Especially they drop it maybe in year 2, they start dropping it because it's very stressful, it's tiring. But I think the main problem is that we have very different academic terms from other courses, and our long school hours that makes it very difficult for us to have work-life balance. Yeah, but I guess in different phases of life in dental school, you kind of have to prioritize different things. So on days when you have less exams, obviously you can go out with friends and enjoy more. But if you have exams coming soon, which we have a lot, then you kind of have to prioritize school. Yeah, but I won't say it's very, very difficult. You just got to try to allocate time for different things at different points in time.